Hi, welcome to Harmonizing Your Horse's Health. I'm Dr. Amy.
And I'm Dr. O. And today, I'm going to play the devil's advocate. Dr. Amy, I hear you tell people all the time, go get your horse adjusted, get your horse adjusted, get your horse adjusted, and that'll take care of the problem. So today, I'm going to ask you specifically how chiropractic care is going to help some of these problems that I've heard you say, and they're not musculoskeletal problems. Is that okay?
Sure, I tell people that all the time.
All right. My horse has an ear shaking problem. He shakes his head and messes with his ears all the time.
You know, I don't see horses shake their head or mess with their ears, but I do see them not want anybody to mess with their ears very often. And I'll tell you that, you know, clients will look at me and say, well, how are you going to fix that? And I am standing right there holding the horse saying, I just did, because we've already adjusted him. What they don't oftentimes realize, Dr. O, is that the nervous system is sensory input from the environment in through our skin, and in particular in terms of the ears, in the muscles that are surrounding those ears. So we're looking at facial nerve muscles, we're looking at all of the branches of that surround that ear and can sometimes be not working right if the head isn't on straight. So if you put your horse's head back on straight with a little chiropractic adjustment, which isn't always easy, especially if their ears are very sensitive or if their poll is very sensitive, then they will stop being so upset about you touching their ears. Occasionally, we even actually adjust the ear.
Okay, all right. I'll give you that one. What about, I have a horse that has sinus problems. Now that's like inside the head, inside the bones.
Well, sure. But you have to remember what is inside that head that's causing the sinus problem, and what's in there is pus. And you know, I'm a veterinarian. I love pus. But you have to remember where pus comes from. Oftentimes, if there's not a tooth involved in causing that sinus infection, we have to go back to remember where blood flow lies in the head. And more often than not, as blood flow circulates through the head, it can actually become impeded when we have muscles that surround the back of the head that are too tight or spasming, when we have joints that aren't moving right because of those muscles. They can actually change the blood flow through the blood vessels that circulate through that area. And when we change that blood flow, we impede venous return. All right, most people forget that arteries go away from the heart. Venous return or veins go back to the heart, but they don't have the muscle in them that the artery does. So blood pressure through them is a little bit different. When blood pools in those vessels, it begins to leak through the sides of the vein. The sinuses are a great place for that leaking blood to pool up, leak through the outside, leave the serum to become that sinus infection or pus in the head. So if we adjust that head and neck and atlas, then we relieve the muscle spasm, we allow for normal blood flow and sinus drainage.
Okay. All right. I've got a horse with a cough. That's not pus.
Is it a dry cough or a wet cough?
Dry cough.
A dry cough. See a lot of those, especially when they're not coughing most of the time, but you tack them up, you get them going around the ring, and the first time around the ring, you get one good cough, and everybody says, oh, it must be the dust in the ring. And I always say, yeah, the dust might be a little irritating, but if the dust is that irritating, he should be coughing the whole time. More often than not, these are horses who have problems with a couple different areas. And it can be the larynx. The larynx is the area where they decide whether they're going to breathe or swallow. And if there's been irritation in the pole, if we've got muscle spasm in the head, again, this is a horse who needs his head put on straight so that all those muscles can work correctly, then that muscle spasm that makes it difficult for him to breathe when under tack or being asked to collect needs to be fixed so that he can breathe without having to cough, to rearrange his larynx and pharynx and get it in the right order. The other area that horses who cough oftentimes have trouble is in the lower neck. As that trachea enters the chest, sometimes there can be subluxations or muscle spasms in the lower neck that put tension on the trachea that will emit a cough. So when they start moving forward, trying to lift themselves up, if there's a subluxation there, particularly if they have a rib that's out of alignment, then they're going to cough a couple times because they are a little bit sore. So if we put those back in place, we're doing great. The third place also comes in the lower neck, C3, 4, 5, sometimes 6, where the phrenic nerve exits the spine. And that phrenic nerve is responsible for normal movement of the diaphragm, that big fan-shaped muscle that protects the chest from the GI tract. If that phrenic nerve isn't working quite right, and there's a little bit of change in the way that diaphragm works, we may elicit a cough as well.
Okay, so I'll give you that one. Allergies. My horse has allergies, Doc.
Sometimes that's a multifold problem, but in terms of chiropractic care, because there are other items coming into play here, we have to remember that's our friend histamine. It's our immune system that's not working. If the immune system isn't working, if it's overtaxed, if it's responding too quickly, that's usually because we have gotten into the inflammation cascade. We have gotten into the activation or overuse of that emergency response to stress, to environment, to damage, to poor nutrition that has got us into a loop that causes an over-response to some of the things that can trigger an immune response inappropriately. Most allergies are actually autoimmune dysfunction. How do we fix that chiropractically? We keep that nervous system working at its top rate. We keep those spinal segments open and fluctuating so that the nerve system can do its job.
All right, I see where we're going here. What about, my horse has a little bit of problem. My vet has said that he may have some heart problems. I know that that's an age problem, but do you still think he needs a chiropractic adjustment?
Age is not a disease. Ever. Age? Heck no. More often than not, those horses that have heart dysfunction who did not come with it, in other words, were not born with those problems and have developed it over time, have developed it because they're having trouble with their vagal nerve, which is the nerve that exits at the base of the skull, travels down the side of the spine, and it helps regulate tone and muscle function of the heart. The other thing that's really cool about the heart is that once it's stimulated, the actual muscle fibers in the heart have nerve type tissue in them. So they stimulate one another as well. So guess what? If we don't have normal initial signaling to that heart, then those individual muscle fibers within the heart can get off and not function to their best efficiency. So chiropractic, keeping that vagal tone normal, can actually keep you from getting heart disease, but it can help alleviate that heart disorder as well.
All right. What about the tube? The tube that runs down through the middle of my horse, the gut. Surely that's too far away from the spine for chiropractic to help gut issues.
But the gut is also innervated and is also signaled by vagal nerve. Our vagal tone is responsible for all of the internal organ systems. And so keeping that vagal tone normal, keeping the normal signal with the neurotransmitters to each of those internal organs normal, is what does things like prevents colic in the fall, prevents Cushing's as the horse ages, prevents, of all things, laminitis. Because what it does is it helps regulate normal release of neurotransmitters. Neurotransmitters are chemicals that fire at the ends of the nerve signal functions to each organ system. They vary from organ to organ and from type of response that the body is looking for. But if we keep those neurotransmitters at a normal rate and normal level by keeping the nerve function that exits the spine, that exits the brain, moving like it should, we can actually alleviate dysfunction in the metabolism. We can alleviate dysfunction in neurotransmitters that cause GI tract motility. A lot of the GI tract dysfunction that we see in the fall and in the spring is related to inappropriate neurotransmitters all year long. When we have decreased neurotransmitter to those areas all year long, those animals, as they come into the fall and begin to lower their metabolism so that they can grow hair and gain weight like a normal horse for the winter, also experience the same depression of metabolism that normal horses do. But they're already at a lower level, so they experience even more depression of neurotransmitter release. Guess what happens? Their GI tract gets out the remote, sits by the TV, and doesn't do anything else. So if we keep those neurotransmitters functioning like normal all year long, we can actually prevent those colics on the seasonal changes. The hardest thing to ever prove to someone is that their horse didn't colic because of it. And it's sometimes the happiest thing that you cannot prove to them.
Okay, all right. So we started up at the top. We've got all the head issues that we dealt with. We got the lung, the coughing, the heart, the GI tract. What about the kidneys, bladder? What about some of those things?
Well, kidneys and bladder are related to acid-base balance in the animal. And their function is also regulated by normal neurotransmitters. But, and this is something we didn't mention when we talked about heart, there's also a communication system between the kidney and the heart that help to regulate little important things like blood flow, blood volume, and blood pressure. And so, keeping normal vagal tone to the heart, normal tone to the bladder and the kidneys, helping keep all of these neurotransmitters at a normal level all year long, helps to reduce stress, helps horses recover from that initial response to stress, you can think of it as helping keeping them more level-headed. You know, you have friends who, when something happens that's really emotional, they just fly off the handle and they carry on about it for months and months and months. And 6 months after you've forgotten about it, they still are bringing it up. Those, like some of our horses, are still reliving those stress episodes. But animals who have a normal, everyday, regular release of all these neurotransmitters, of all these nerve functions that exit the spine at a normal rate, that don't have decreased blood flow because that spinal segment is not functioning because it has muscle spasms surrounding it, those horses are going to rebound from those from those acute situations much more easily, and they're not going to carry it forward to affect blood pressure, heart rate, blood volume, urine output. They're not going to dehydrate as easily. They're not going to become as acidic because they're breathing faster every time they think about the potential of something going wrong. So, does it affect behavior? Absolutely. And what it does is it helps make them more stable individuals.
All right. I think I've got the last one. And I don't think you can help it. I have a breeding program. My conception rate and my live delivery rates just aren't what they should be.
You need to chiropractically adjust your horse. All of them. Stallions included.
No.
Absolutely. Why? The nerve response from, you have to remember that sensory input to the brain causes motor output to the tissue. All of the tissue, including those that you can't see or feel or necessarily even think about because you don't really know what they look like. Oftentimes I'll say to my clients, I want y'all to just stand there and feel your appendix. Don't touch it, just feel it. Most of them look at me a little funny because most of us don't think about our appendix every day. All right? But in animals, in everyone, there is sensory input to the brain from all of those organ systems, and there's motor output to them. The uterus has smooth muscle and lymphatic tissue. And if that smooth muscle isn't working like it should, it can't drain well, so it won't be ready for conception. The testicles, same deal. If there's muscle spasm in the back of the horse surrounding the spine, where the sensory input from the testicles comes in and where motor output to the surrounding tissue goes out, is impinged on, they won't get normal signal. And so, you won't have normal you won't have normal sperm production either. So, can I fix everything with chiropractic?
Almost. It seems like we can really help. And we both believe that. And I was just playing the devil's advocate today because my practice is 90% chiropractic care. Dr. Amy's practice is 70% chiropractic care. We would like you to use chiropractic care to help you harmonize your horse's health, and to find a chiropractor in your area, you should go to
obviously the AVCA, or American Veterinary Chiropractic Association doctors.com, where you can find chiropractors who are trained animal chiropractors in animal chiropractic.